Welcome back to Be Kind Pediatrics. Today we're going to go over language hacks to help your child develop language skills. Have you ever wondered, is there a way that you should be talking to your child? Should you be talking to your child every day? Is there anything that you can do to help your baby acquire language skills? The answer to that is yes, and we're going to go through some of those today.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
For those of you who are new to this YouTube channel or this is the first time you're watching, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and a mom myself. Communication usually follows a set roadmap for the way that we acquire language. All children learn receptive language before they learn expressive language. So what I mean by that is children learn to understand what is being spoken to them before they can actually express what they're thinking. And the development of skills for expressive language actually start between 0 and 3 months old. One of the first things that you might notice your baby starts to do is to use their mouth. So they use their mouth for breastfeeding, but they also put lots of objects in their mouth. We usually refer to this as mouthing. And so traditional baby toys like rattles, or for example, this rattle from Love Every, which is high contrast because again, visual skills, newborns don't see colors very well. They see high contrast better. And so kind of a black and white rattle not only helps with gross motor skills to be able to hold on to this rattle, visual motor skills to be able to see the black and white, but also language motor skills by being able to mouth this and using the muscles in their mouth to mouth it. And also because it makes a noise, it helps with receptive language by helping them develop their vestibular development, which is our ears are hearing. So again, normal language development, babies will learn to what we call coo before they babble. So one of the very first milestones that you will see for expressive language is cooing, or those vowel sounds, ooh, 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 ah, ah, ah. And the reason for that is because babies are better at keeping their mouths open wide. It requires more skill to have a tighter control of your mouth. And it doesn't require as much of their lip or tongue movement. So again, giving your baby things to both hear and actually put in their mouth will help them learn to close their mouth so they can go from cooing, ooh, 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 to babbling, which is the combination of vowels and consonants, something like la, 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 ba, 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 which is also why in a previous video I discussed additional hacks for helping your child learn language skills, in which we kind of talked about books that I recommend. And one of the books I recommend for an early age is Ba, Ba, La, La, because it helps children hear and see your mouth so that they can learn from going from those vowel sounds to the consonant sounds. Speaking of your child watching you talk, another great hack is to talk to your child. And you don't have to do it all day long because that's exhausting, but you should do it with intention and purpose at points throughout the day. So what do I mean by that intention and purpose? I mean, there is evidence to show that talking to children in a certain way engages them more and helps them acquire language more efficiently. So I will give you a demonstration with a book because I just find that to be a little bit easier. So this is a type of book I would recommend for a child from 0 to 4 months of age because it's high contrast. You can again refer to that video I did about the fact that there's no words on it yet and that there's nothing else on the page, so it's not super distracting. So for example, if I was going to read this book to a classroom of young children or to one young child, I would have them facing me so that they can see my mouth because that's more important than seeing the book. And I might read it like this. Wow, look at this. What's that? That's a bird. Right, that's a bird. What noise do birds make? Birds go chirp, 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 chirp. And so let's break that down, because there's a few things that I did in that demonstration that are actually evidence-based. So first, you want to talk very slowly. So what's interesting about this is I actually put this into real life demonstration to see if it was effective at all. So I recently wrote a book to my son's classroom. They're all less than 2. And I did it in that manner. And afterwards, his teacher said to me, wow, that's the first time I think the children have sat through an entire book. And part of the reason for that is probably the way that I was reading it to them is a little bit more engaging for them. And so let's talk about some of the things that I did in that demonstration to hopefully engage a child. So first, you want to read very slowly. A few things happen when you read slowly. One, it allows you to really overemphasize the shape of your mouth, which is, again, how children learn to mimic the way that our mouths are moving, helps them with their phonics and learn to have expressive language. 2, it allows for large changes in your tone. So by that, I mean, again, wow, what is that? That's a... So the changes in tone are also an evidence-based intervention to help children acquire language. Reading in a higher octave also helps children acquire language faster. Pausing. So pausing gives children, especially older children, the chance to communicate back with you. So depending on their age, their first communication or expressive communication gesture might be looking, then pointing, then they might make some of those babbling sounds or the beginning of the word, ba-ba. And that's also why I went, what is that? That's a... If your child doesn't know the word yet, just start with the beginning sound. That's a ba, and try to give them a pause, about 5 seconds, depending on where they are in their development, to finish the sentence, to look at it, or to point at it. And we're going to talk more about the importance of the pause later. The other thing I want you to encourage you all to do is actually to use proper grammar and proper pronunciation. And lastly, pointing. Pointing is an extremely important part of early expressive language. Again, I said children usually learn to point before they learn to actually use their words. So paying close attention to your child's pointing helps them communicate with you in multiple ways. One, when they communicate by pointing and they get what they want, that positively reinforces communication. 2, it helps them not get frustrated by trying to tell you what they want without you being able to interpret what they want. And we'll talk more about frustration and communication because this kind of leads really nicely into infant sign language. And 3, it helps with their fine motor skills. So pointing uses one finger. It actually requires you to have control of not only your hand and your wrist and your arm, but also the little muscles in your finger. So now let's talk a little bit more about the pause. So if you refer back to my video about normal communication developmental milestones, one of the things I talk about is the progression of expressive language. And one of the first things that we see with expressive language with intention is between 6 to 9 months, children learn to look at objects that they want. A little closer to 9 months, they learn to point to objects they want. And then between 12 and 15 months, they might actually start to use some of their words to describe what they want. A common thing I see with very well-intentioned parents is that they anticipate their child's needs before they have a chance to actually communicate this to them. And I particularly see this in scenarios where there's maybe the child is the very youngest in the family and there's a bunch of older children in the house, because then they also get really good at anticipating their siblings' needs and they don't give them a chance to communicate it. So the pause is really important in giving children a chance to communicate what they want. It doesn't have to be a long duration, something like 5 seconds, but it gives children a chance to either look, point, or say what they want. And this in turn empowers them when they get what they want by communicating to continue to encourage them to learn how to communicate. To try to minimize your child's frustration when you pause, you want to do things like look at them. You might raise your eyebrows and be inquisitive, like you're waiting for them to speak and communicate with you. This shows your child that you're paying attention to them, that you're present, and you are here for them, but you want them to tell you what they want. When you set that expectation, it helps children learn that they need to A, communicate, and B, again, empowers them that they can communicate to get what they want. So let me demonstrate this for you. Maybe what your child really wants is this bee. So put it, especially if you know this is their favorite toy, you can put it just out of reach. Then pause. Give your child a second to either look at it, to point at it, or to name what it is. When your child communicates their want for you, you can pick it up and give it to them. But you also want to do a few other things. When you give it to them, you want to give it to them like this. What's that? What's that? That's your bee. Here you go. Here's your bee. What sound do bees make? Bees go buzz, buzz. And by repeating what it is a few times, repeating that it's a bee several times, making the sound that bees make, and by pointing and being playful, you're really engaging your child in the language acquisition of the word bee. So a couple of tips and tricks for how to do this. If you're busy throughout the day and you have a couple minutes, you can put your child's favorite toy just out of reach and really watch them with intention to see if they're communicating that they want that object with you, and then give it to them in the way that I just went through. Other ways to kind of incorporate this throughout your day without necessarily using a toy. A nice time to do this is at dinner time, which is a need that we really want children to be able to express when they're hungry or when they want food. So you can just put down their plate and pause a couple of seconds and wait to see if they look at their food, if they point towards food, or if they make some sort of communication that would suggest that they want food to help them, again, encourage them to continue to communicate their needs. You can do this on the playground. So for example, if you're at the playground and your child really enjoys the merry-go-round, you can put them on the merry-go-round and then pause a couple seconds and wait and see if they communicate with you in some way that they want you to give them a push. You can do it, for example, if you're at the window, you can look at the window, and if you see something like somebody walking their dog, you can pause and wait and see if they look at the dog or look at the person and say, wow, look, there's a dog. What sound does a dog make? A dog goes, woof, woof. And so you can kind of incorporate the pause into multiple times throughout your day without having to do it constantly. Again, some of these objects, like I had in this video, are from Love Every, although you can certainly get high contrast objects from many places now. If you want a Love Every subscription and you don't have one, I will leave a discount code below in our comments. If you found today's video helpful or you really enjoyed it, I encourage you to give us a like or subscribe to our channel for more great content.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.